So Catherine is a professor of literature and creative writing in the Department of French at Université de Montréal, and an award-winning writer who has published 9 novels, including The Ballad of Ali Baba. I'm free translating. The Last Days of Smokey Nelson, The Bay City Sky, Oscar de Profundis, the Annex, which just recently came out, and is the author of an oratorio called Omaha Beach. She has written also, on top of her fictional work, many essays, including Diamanda Galas, Warrior, and Medusa, and L'Éternité en accéléré, which is basically accelerated infinity. Her books have been translated in multiple languages and have won also numerous awards. As a researcher, she has worked on different subjects, such as transmission, mourning, and illness in modern writing. Her research attempts to think about the literary and social discourse on current health issues, and the ideas of contamination, contagion, and influence in the writings of HIV/AIDS, and the imaginary of confession and suffering contemporary narratives. Most recently, she is co-chairing a research creation chair, wherein she is with her group focusing on the narratives of transplantation and the fragility, vulnerability that arise from that interconnection. So she's interested over the course of her tenure as a professor and a writer in the creative process and thinking about the creative process, and also unsettling the creative process through discourse, theory, and artistic work. So thank you so much for being with us, Catherine. We have decided that today's panel would be an exchange and a dialogue, and that you may sort of begin the dialogue, initiate the dialogue, I believe, with a text that you have decided to read to us today. And if you want, you can spend maybe a minute or two telling us what the text is about, or jumping into the text with zero context.
Thank you, Eftihia. Do you hear me? Is it okay? I'm very pleased to be with you today, and thank you very much, Eftihia. It's the first time that we speak in English together, and it's strange, but I like it in a way. Well, I was very interested by what Sander Gilman said about pandemics and AIDS, because I was surprised in a way how he thinks about the AIDS epidemics. And I have a slightly different point of view. I'm very reluctant to talk about blaming the responsible of some behaviors, even if he doesn't say that completely. But I was a little bit surprised by what he said. And I think that that is maybe because I think that my way of avoiding this kind of discourse is to produce novels, is to produce fiction. I don't have to decide what I think. I can say something with a character and say another thing with another character. Sometimes my discourse is very confused, but I think that trying to think in this moment about the pandemic is very difficult, and Sander Gilman is very interesting, but my point of view will be more specific and more emotional. I think that the way I think about those things is very emotional. So I will give you a reading. I don't know how many minutes you want me to read, Eftihia, but I will give you I will read one of in fact, my first book. My first book was Deuil, Cannibale, and Mélancolie, which was translated in French, Melancholic and Cannibal Mornings, or someone else translated it as A Feast of Lamentation. I wrote this first book in 1996. I've lost, at that time, I had lost a lot of friends. And suddenly I realized that I was in mourning. One day, one of my friends told me that one of the guys I knew was dead. And I say, that's a lot, that's a lot. And suddenly I decided to write, to put together this memorial for my friends. Though this is not a funeral for a friend, as Elton John said, but it's a memorial for many friends. So I will read the beginning of my book, and then I will try to discuss with you. I found out a friend has died as regularly as other people pick losing lottery numbers. This week, I lost another Hervé, which was to be expected. Statistically speaking, all my friends are named Hervé and are, for the most part, HIV positive. Death clocked in statistic brings no relief, especially from its unpredictability. I can't get used to death. I never see it coming. Hervé's death hit me like that. Bang, bang, you're dead. It's a bang that never fails to surprise me, a bang heard over and over again. I feel guilty that I'm still alive, and yet I will also die. It is statistically predictable. But what does that give us in the way of assurances? I am a date machine. I am a mechanism recording numbers and figure. I am the perforator punching out the days. I am a highly perfected German device, or more likely a computer that insensately answers the call of the past. Not a day goes by that isn't the commemoration of another. I know the dates of the birth and death of an incalculable number of people. And if by any chance a date fails to remind me of something, I know it's because that day is reserved for a new catastrophe. The days themselves are also haunted, full of ghosts. They are loaded with the past. There is nothing we can do about it. Hervé was born on June 16, 1949. He died on June 18, 1989. He had just celebrated his 40th birthday in the hospital, and I imagine his room flooded with light and an abundance of plants, giant flowers, the luscious pornographic flowers that he would have received. Hervé had once dreamed of dying in the early morning, killed by a one-night stand in a tourist room. I see him dead on the morning of the 18th of June, after having spent a sweaty night with a man who had slipped to his bed and smothered him with embraces. Hervé died from lack of air, that much is certain. And the killer even has a Latin name, Pneumocystis carinii, a fetish name, a talisman name that Hervé had written with the pride you take in saying a new lover's name. Thus, Pneumocystis carinii killed Hervé in the early morning hours, in the room full of flowers and awash in sunlight. He wrote to me on June 14th, 2 days before his 40th birthday, 4 days before his death. I don't think I told you I have AIDS. It attacks my lungs, this Pneumocystis carinii. Actually, I don't think Hervé spoke to me about his illness, even if his voice on the phone on June 12th sang a familiar tune, the song of someone who couldn't breathe anymore, the song of the beautiful swan that Hervé was in my eyes. I don't believe we ever say the word AIDS during our conversation. And I certainly find it hard to believe that Hervé didn't remember our mutual silence, but how our confessions made. Whether we like it or not, homosexuality is a question of confession. Say it, don't say it, understand. Let it be understood. Let it be heard. Do you hear me? Say nothing. Know it without words. Cult of the dead, cult of the confession to be made over and over again. Always wear your badge, and this is not enough. You must explain why, how, with whom, the first trauma, and the last lover. If you don't mind, Eftihia, maybe we can talk a little bit and then I can read again if you think it's nice, or we can skip my lecture, whatever you want.
Yes, let's do that. We can go back and forth, and we can dance the dialogue.
Thank you.
So there's so much to say about that, about the relationship between your writing and the constant revival of death, and also the pain of disappearance of a different type of community here. Although the community was present in Sandra Gilman's talk, you were thinking about the community in more affective terms than behavioral terms, even if there's a relationship within the symbolic here. So I'm just wondering, I know it's difficult to hear me because of the echo, but I know that, for instance, in the early 90s, you had the opportunity when you were at Concordia University, before going to Université de Montréal, you felt the heat, not only the heat to write and to have cohabitate all of these contradictory, complex, contaminated voices and bodies cohabitate within the place and the space of the text, but also you felt the heat to act within the space of pedagogy and academia, within the relationship of pedagogy and academia and the community in Montreal, specifically in 1993. And I always feel like, as a literary scholar today, there's oftentimes a misunderstanding about the relationship that we have with community-based work and how research and creative work can coalesce in moments of crisis. And so I would like for you to tell me how, in many ways, this community-based work that you did at Concordia University either serves as a supplement for what you do, or something else. Like, what does it speak to? How does it speak?
Thank you very much for this question. At the beginning of the 90s, I was a professor at Concordia. I was a young professor, and I had a PhD in comparative literature. And you know, my PhD was on Romanticism, and I don't remember exactly what it was about, but it was about, yeah, Romanticism and Heidegger, and the links between the mother tongue and the other tongues. So it was really, I was really a scholar, and suddenly I had the chance. I was very lucky. I had the chance to go and teach at Concordia, and I don't know why, but maybe just because of my friends dying, I decided to work on a research project about syphilis and AIDS. I wanted to analyze the end of the 19th century and the end of the 20th century. And suddenly I don't know why, I thought that what I was doing was completely obsolete. I think that I say the way I'm doing it, it's completely irrelevant. I have to do something else because I'm in a tour d'ivoire. I'm in a space completely safe. I have to do something completely new. And I met Tom Waugh, who was a professor in the cinema department, and Chantal Nadeau, who worked in communication, and now she's in queer studies in Bloomington, I think, or Urbana-Champaign, maybe Urbana-Champaign. And I met them, and suddenly Tom Waugh was an activist. He was very an important activist, and he was a great professor of cinema. And he decided that we needed classes at Concordia, classes on the subject of AIDS. And he wanted that to be a transdisciplinary, to do that from a transdisciplinary point of view. So he talked with me, he talked with a woman in sociology, anthropology, French shaver, who was working on sex workers. He talked also with a man who was in a artistry, and he decided that we should do something. And Tom, and it was really Tom who was the leader on that, he established a transdisciplinary class on AIDS for the community of Concordia. And we invited in this course, we invited doctors, we invited novelists, we invited everybody that we thought was concerned by AIDS, and also patients, and also sick people. And it was very interesting. And we had the chance, or I don't know if it was a chance at that moment, to invite someone like Montagnier, who was working on AIDS. And but also, not also the big shots of the AIDS research, but also some people talking, struggling with the disease. It was, and we were confronting those discourses. And I've learned there something about the way I wanted I wanted university to be. I wanted the university to be a space for activity. I don't know if activism is the right word now, because maybe the meaning has changed, but I wanted the university to be a place of passion, a place of problems, a place of real people thinking, and of, you know, and it's not, and I wanted to to think about a theory as a way to understand the world, and not only to impose a point of view on the world. So it was, for me, it was an extraordinary experience. And I've tried in my life, and it's not easy because I teach in literature, and now I teach at the University of Montreal. I've tried in my life to do something like that, because, and now I'm doing it, I think, with the Chair McConnell, the Chair McConnell. I give a creative writing class to people who had been transplanted with a new kidney or a new heart. And I'm trying to understand how I can teach creative writing, not only to students who want to be professor or writers, but to people who just want to write or to think or to talk or to create something. So I really think that the AIDS was for me like a moment that I still that I am I'm aware of. AIDS is always is a constant thought in my mind and in my practice, because it has taught me everything, you know, and it has taught me how to think not only in an institutional way.
Thank you. I 100% agree that, at least from my point of view, you've always been that person that has pushed back in her work, but beyond her work as well. And I think that figure that pushes back is oftentimes placed on the figure of either the artist, either the person who's ill, right? But rarely pushed on the figure of the doctor, the one who pushes back, or the one who is contaminated themselves. And I think that from the work that I know that you've done, but also from that specific period in the 80s and the 90s, that the doctor, the medical practitioner, within a specific community was also the one that was ill. And I know that within your work at that time, you had doctors present. And the doctors were not working within spaces that were legitimate. They were working within clandestine spaces, underground spaces, spaces where vulnerability, spaces where unknowing, spaces where the notion of health were being contested, but also the notions of pleasure as well. And I was just wondering how within your work, particularly your creative work, this idea of running after doctors who can understand, also trying to find a community of knowledge keepers that were also knowledge seekers, allow us to think about the notion of the community as being clandestine, and as clandestinity being sort of the premise, the initial foundational premise for thinking about the future.
Thank you. Yes, I was talking about the transformation the academics had to realize with AIDS, but you're completely right. The doctors changed completely, and the way to practice medicine has changed, partially, of course, but I think that there is an epistemological turn at that moment with AIDS. I think that the way the doctors were perceived and conceived before AIDS was a very authoritarian figure, with a healthy figure. I know that the Greeks wrote, and I think that is Hippocrates, wrote about the health of a good doctor. A good doctor is someone a little bit fat, because at that time it was healthy to be fat. A good doctor is someone with a pleasant life, and he can talk about health because he is in good health. You know, there was this portrait of the doctor through the centuries. Then with AIDS, something completely changed. The good doctor, the Marcus Welby, I don't know if you know this TV series, the good doctor, the Marcus Welby, were not really related to the disease, had to be related, because if you wanted to be cured at that time, you had to see a doctor who was aware of illegal drugs, who was aware of experimental drugs, and who was aware also of things that were not supposed to be known. So I think that the friends that I had went to doctors who were also HIV positive, who who were dying of AIDS. You know, it was a terrible time. And Hervé Guibert, who is a French writer who died of AIDS at the beginning of the 90s, wrote a lot about those doctors. He wanted to see a doctor who, at the beginning, who was exactly like him. And suddenly he realized it was maybe dangerous for him because he didn't know who would survive. But I think that this affect of the doctor affected by the disease and affected by emotion is very important. And I will take a Québécois example. There was a movie in, I don't know exactly when it was, maybe at the end of the 90s, but it's a médecin de cœur, doctors of heart, and heart doctors, but in French it means, you know, they are people with a great heart. And ces médecins de cœur, they were talking, it was a documentary about AIDS and on doctors. And those doctors were really, really in the middle of the crisis. One of them died, one in the movie cries. It is Régent Thomas, who is well known about his activism in AIDS problems, you know. And we saw doctors completely in crisis, and suddenly knowledge was different. Knowledge was not the distance with your patient. Knowledge was being able to cry for your patient, being able to feel the same thing as your patient felt. You know, it was completely different. The notion of the medical knowledge at that moment for me changed. And now I think it's important that we see, for example, doctors specialize in breast cancer, women specialize in breast cancer who had breast cancer. It's not a disqualifying quality to be sick. At the contrary, it's a way to show you care and that you will fight for your patient and with your patient. And I think that AIDS was exactly the moment that medicine had to rethink the way it constructed knowledge and power.
Absolutely. So this notion of the coherent ego or the ego coherence is dismantled, is completely dismantled because all of a sudden the boundaries of the bodies become shift, right? Become more porous. So I think it's so fascinating. There's so much to say about this, about how in reality in the 90s, there's truly a paradigmatic shift that comes from the bottom, that comes from those who are unseen, that comes from the notion of who gets to keep the knowledge, who gets to share the knowledge, but also who gets to participate in the construction and the production of life and death. I know also that as a professor of research and creative writing, you also work not only with different discourses stemming from society or stemming from your own writing, but you're also particularly interested in types of cultural artifacts that come from below. And I know that you have referred to me to this magazine that was called Diseased Pariah News. And I didn't know if I was going to bring it up today, but I am bringing it up only because Sandra Gilman talked about the pariah in Thucydides' Peloponnesian War, right? As sort of the other, right? The other, the radical other, the radical alterity that is always outside, but whose presence is always at the limit And I was wondering if, since our audience is not necessarily familiar with this, if you can speak to how in reality the production of certain texts emerged. Not only did we have a production of knowledge through the transformation of the subject of the knowledge keeping, right? But we'd also have a transformation of text, of the nature of text, and what got to be included in the text, both through different mediums, but also through sexual practice, right? So how did the community have transmission of knowledge, right, outside of the clinic, when in reality the doctrine was already outside, was already occupying, traveling, mobile at the outskirts, right?
Yeah, thank you very much for this opportunity. I think that when we talk about disease, the discourse is always happy to say, to think about the ways not to get infected. I think that's the way we think it. You know, we talk about behaviors, we talk about ways to eliminate the disease. But at that time, things were really different. A lot of people were already infected and dying. It was not possible only to say for those people, for those communities, to say, well, it's time to think about not being infected. It's time to change behaviors. It's time. It was not like that. It was to occupy a place, to be imaginative and creative, going to death in the way, because they were dying. So Diseased Pariah News was a wonderful little publication. I'm just giving it right now to you like this. You know, it was something very, some people would say trash, but it was done by people who were sick, and they were taking and they were writing things about, for example, one of the title of an article was "How to Die Without Really Trying," or why people HIV positive are sexier, something like that. They wanted to create an imaginary about people dying, a kind of, maybe sometimes a lot of people say it was a camp or kitsch imaginary, but they wanted to do that and to create a space to continue to be, I don't know how to say that, but really creative while dying. And this space was not, how would I say that? Very politically correct space. It was not, we are good people trying to avoid other people to die, trying to be, to adopt good behavior. They were radical. They thought that they could say in a space like their journal things that they were thinking. And I really appreciated it as a writer, as a person who loves literature. I think that the discourse that we hear every time about prevention, about being not infected is important. And I don't want to minimize it. I want to be careful with this. But I think that from a point of view of discourses, it's a discourse that we all know that everybody can write. What I'm interested in is other forms of writings, other form of talking, creative forms of talking. And I will give an example, and I will not take it from the HIV positive guys from the 80s. I will take it from the people who had a transplantation, who received a kidney recently. They don't want to say only thank you to their donor who's dead, by the way, so a lot of times. But they also wanted to be nasty. They also wanted to create, they think sometimes that they are haunted. They think that they shouldn't have done the transplantation. So I think that I'm creating in my creative writing session spaces to say things that can't be said, and do something with it, and be part of a community that is not completely pure, that is not completely saying the things that the doctors or the health dispositif want us to say. And Disease Paria News for me was the place to understand a kind of resistance. It's not a resistance only against the disease, it's a resistance against language, a language with completely constructed, and we can hear the voice of people dying in this pre-constructed discourse. And, you know, I think that you talked about Amanda Gallas, who is a singer and a writer and a performer. And she tries to do the same. She tries to, but she has a beautiful voice. She's a soprano. And she wants to let us hear the voice of the dead or the dying. And she did that in the 90s, and she's still doing it because she lost her brother, and she wants to think about it and to think about her sorrow. So the discourse of the victory to come against the disease is not the only one. And I think that Disease Paria News was able to think about it, and that fiction and literature is, or art or songs are able to say something else about, or dance are able to say or to show something else about the disease and the pain.
Yes. So, like, obviously there's so much to say about how literature and art are not a communication, a communicative tool, but a language nonetheless. And I want to thank everybody who attended Catherine's talk, who have the opportunity and had the opportunity to meet you, and for your opportunity to share and be with us today as well. So thank you, Catherine, again.
Thank you to Ariane, and thank you to you. Thank you.
Bye.